Now, we briefly mentioned cholangitis in the last lecture, as it is a serious complication of cholangitis. But we're going to delve deep into the topic of cholangitis now, with much more detail. Cholangitis is a serious infection of the bile ducts. This complication is not only important because of its severity, but also due to its diagnostic challenges and need for prompt treatment. But what is cholangitis? Cholangitis essentially is an inflammation of the bile duct system. The most common cause is a bacterial infection, which often occurs secondary to obstruction in the bile ducts. This obstruction can be due to gallstones, strictures, tumors, or other causes. While not as common as gallstone disease, cholangitis is a significant clinical entity. Its prevalence is tied to the incidence of risk factors like cholelithiasis and prior biliary procedures. Now, the pathophysiology revolves around two key elements: obstruction and infection. Obstruction most commonly is due to gallstones, which leads to bile stasis and increased pressure in the bile ducts. This environment is conducive to bacterial growth, leading to infection. Bacteria usually ascend from the duodenum and in some cases can reach the liver, causing liver abscesses. But, pimp question. The most common bacteria causing cholangitis is E. coli. Other honorable mentions include Enterococcus, Klebsiella, and Bacteroides. Now, how are patients going to present with cholangitis? Patients with cholangitis may present with Charcot's triad, which is right upper quadrant pain, fever, and jaundice. Charcot's triad is the classic presentation of cholangitis, but it's worth noting that Charcot's triad is noted in only 25% of cholangitis patients. In severe cases, patients with cholangitis present with Raynaud's pentad, which adds hypotension and altered mental status to Charcot's triad, indicating a progression to septic shock. With Raynaud's pentad, there is a 50% mortality rate. This is a surgical emergency, if there ever was one. We need IV antibiotics and ERCP and immediate surgery consultation. Now, how are we going to diagnose cholangitis? Diagnosis is based on clinical presentation, laboratory findings, and imaging. Elevated liver enzymes and leukocytosis are common. Imaging, particularly ultrasound, is critical for identifying biliary obstruction. MRCP or ERCP can provide more detailed views and are essential in certain cases. So how are we going to treat cholangitis? As previously mentioned, the management of cholangitis is two-pronged. 1, addressing the infection, and 2, relieving the obstruction. Broad-spectrum antibiotics are initiated promptly. Cholangitis requires broad-spectrum coverage with double or even triple antibiotics, specifically targeting gram-negative and anaerobes. For example, ceftriaxone and metronidazole, or Zosyn. Endoscopic or percutaneous drainage is typically performed to relieve the obstruction. In some cases, surgery may be required, especially if there are gallstones or a need for biliary reconstruction. Patients with cholangitis should be admitted to the surgery service or go straight to the OR. The definitive treatment of cholangitis is early biliary decompression and can be accomplished by ERCP, PTHC, or surgery. Now, what are the complications of cholangitis? If left untreated, cholangitis can lead to serious complications like sepsis, liver abscesses, and biliary cirrhosis. Early recognition and treatment are vital to prevent these outcomes. This is one of those diagnoses that every minute counts, and immediate treatment is necessary even with the slightest suspicion. because there's a 50% chance of death from this illness. How are we going to prevent cholangitis? Prevention strategies focus on managing risk factors for biliary obstruction. Patient education is crucial, especially for those with a history of gallstones or prior biliary procedures. They should be aware of symptoms that necessitate urgent medical attention. That pretty much sums up cholangitis. Cholangitis is a serious condition requiring prompt diagnosis and treatment. It's a great example of how interdisciplinary care involving gastroenterologists, surgeons, and radiologists can significantly improve patient outcomes. So, that pretty much sums up cholangitis. It's definitely a diagnosis that you don't want to miss. And after this lecture, I'm sure you won't. As always, keep your head up. You're doing great. You're better than what you were yesterday. And that's a lot. Learn something new today. Going to be a great doc. Sometimes you just got to hear that.